Chronic thromboembolic pulmonary hypertension, or CTEPH, is a serious medical condition. It affects the lungs and heart. CTEPH is a type of pulmonary hypertension. This means it causes high blood pressure in the arteries of the lungs. This can make it hard for the heart to pump blood effectively. CTEPH occurs when blood clots form in the lungs. These clots block the flow of blood through the pulmonary arteries. Over time, these blockages can cause damage to the arteries and increase blood pressure. This strain on the heart can lead to various health problems. The condition is chronic, meaning it persists for a long time. This distinguishes it from acute pulmonary embolism, where blood clots travel to the lungs suddenly. Understanding the difference is crucial for effective diagnosis and treatment. CTEPH is a relatively rare disease. However, it can be life-threatening if left untreated. Recognizing the signs and symptoms early is crucial for improving outcomes. The exact causes of CTEPH are not fully understood. However, it is often linked to a history of blood clots in the legs or lungs. These clots, known as deep vein thrombosis, or DVT, or pulmonary embolism, or PE, can sometimes lead to CTEPH. When a blood clot travels to the lungs, it can get stuck in the pulmonary arteries. In most cases, the body naturally dissolves these clots. However, in CTEPH, the clots don't dissolve completely. This can lead to long-term blockages and damage. As the blood flow is restricted, the pressure in the pulmonary arteries rises. This forces the heart to work harder to pump blood through the lungs. Over time, this can weaken the heart and lead to heart failure. The reduced blood flow also means less oxygen reaches the body's tissues. This can cause a variety of symptoms, including shortness of breath, fatigue, and chest pain. Several factors can increase your risk of developing CTEPH. One of the most significant risk factors is a previous episode of DVT or PE. If you've had blood clots in your legs or lungs, you're at a higher risk. Other risk factors include inherited clotting disorders. These are genetic conditions that make your blood more likely to clot. Certain medical conditions such as cancer, heart failure, and chronic obstructive pulmonary disease or COPD can also increase your risk. Lifestyle factors can also play a role. Prolonged immobility, such as during a long flight or bed rest, can increase the risk of blood clots. Smoking and obesity are also associated with an increased risk of CTEPH. Being aware of these risk factors is important. If you have any of these risk factors, talk to your doctor. Early diagnosis and treatment are essential for managing CTEPH and preventing complications. Recognizing the signs and symptoms. The symptoms of chronic thromboembolic pulmonary hypertension can vary from person to person. They often develop gradually over time. In the early stages, you may not have any noticeable symptoms. As the condition progresses, you may experience shortness of breath, especially during physical activity, fatigue, chest pain, swelling in the legs or ankles, and even bluish discoloration of the lips or skin, known as cyanosis. These symptoms are not exclusive to CTEPH and can be caused by other conditions. However, if you experience any of these symptoms, it is essential to see your doctor. Early diagnosis is crucial for receiving prompt treatment. It is important to note that CTEPH can sometimes develop even years after an episode of deep vein thrombosis or pulmonary embolism. Therefore, it's crucial to be aware of the symptoms, even if you've had blood clots in the past. Exploring treatment options for CTEPH. Treatment for chronic thromboembolic pulmonary hypertension typically involves a combination of medication and surgery. The goal of treatment is to improve blood flow through the lungs, reduce pressure in the pulmonary arteries, and manage symptoms. Medications used to treat CTEPH include blood thinners, diuretics, and oxygen therapy. Blood thinners help prevent new blood clots from forming. Diuretics help remove excess fluid from the body, reducing strain on the heart, and oxygen therapy, where supplemental oxygen can help improve breathing and reduce shortness of breath. In some cases, surgery may be recommended. The most effective surgical treatment for CTEPH is pulmonary endarterectomy, or PEA. This procedure involves removing the blood clots from the pulmonary arteries. PEA is a complex surgery that is not suitable for everyone. Your doctor will assess your individual circumstances to determine if PEA is an appropriate treatment option for you. Importance of early diagnosis and conclusion. Chronic thromboembolic pulmonary hypertension is a serious condition that can significantly impact your quality of life. However, with early diagnosis and appropriate treatment, many people with CTEPH can lead full and active lives. Recognizing the signs and symptoms of CTEPH is crucial. If you experience any unusual symptoms, don't ignore them. See your doctor for a proper diagnosis. Early detection and treatment can make a significant difference in managing the condition and preventing complications. If you have a history of blood clots or any of the risk factors associated with CTEPH, it is important to be especially vigilant. Regular checkups with your doctor can help monitor your health and detect any potential problems early on. MD Searchlight. Be your own advocate.